Number one, the selection of good patients. It means that rhinoplasty and facial plastic surgery is not useful for all of the peoples. Their reason that they want to perform, for example, rhinoplasty is the most important thing. The motivation factor and motivation reason is very important. The expectations of the patients are very important, and they must think, their thinking is very important. What they want after the surgery, what's the reason that they want to do rhinoplasty, to undergo rhinoplasty, to perform blepharoplasty. So the patient selection is very important. Number two, the stability of the personality and psychological aspect of the patient are very important, and the relationship of the patient with his or her family are very important. Number three, the best technique that will works for that patient is important. It means that each surgeon must know different techniques to perform rhinoplasty, and he and the surgeon must use the best technique for each patient.
There is one nice trick that I learned and I want to share with everybody. The closure of an open rhinoplasty is tedious. It's at the end of a long surgery, and we use very fine suture material. I usually use 7/0, which is really small. But to take out the small sutures after a week or two is painful to the patient. So now I use a suture that is resorbable. It's called Velosorb Fast 7/0. From Covidian, and it has a strong needle. It's very beautiful to sew, and the beauty is after 3 weeks, takes about 3 weeks. After 3 weeks, you just pull a little bit on the threads and they fall out absolutely pain-free for the patient. That is really great. Another very important tool that has changed the practice of my rhinoplasties is motorized instruments. Motorized means going in a sagittal way, especially for rasping and for sawing. So if I do a hump reduction, I don't use the osteotome anymore, but I only use the motorized rasp because I can go on the bone and shape it with that motorized rasp that goes very fast, and at any time I can stop and have a perfect surface. There is no edges, no sharp edges, no fracture lines or anything like that. This is great, a great tool. It's from Stryker or other companies that have this rasp. And the same instrument has also a sagittal saw. So you can do your paramedian or oblique, lateral, whatever cuts in the bone. And it's so much more important to do it with a motorized instrument than with a chisel, because with a chisel, you break open the bone, you fracture the bone, which you shouldn't do. With the cutting instrument, you don't do anything to the lateral bone. You just cut through it, period. It's much cleaner, much more precise, and I strongly suggest it.